Now, can you give us a sneak preview of what you're going to be speaking about on January 3rd? Your presentation is entitled Dietary Supplements, Integrative Medicine and Health. What has research taught us?
Yeah, I'm actually really excited to be giving the Grand Rounds for January for several reasons. One is that it's not often that people really get the opportunity to get a summary of what research has already been done, which on certain levels has actually been extensive for selected vitamin mineral supplements, but not necessarily across all the ones that people are typically taking, with the perception of health, but not necessarily any proof of it. And we know that for many supplements, there are legitimate safety concerns that could be raised either about the quality of the supplements themselves or the health effects that they purport to be beneficial for. So part of it is to kind of review what evidence is out there already in terms of dietary supplements, but also to think more carefully about how the concept of a large and simple randomized trial for selected dietary supplements can be quite informative for looking at different types of outcomes. The other thing is to also kind of emphasize, what are the new areas of work that we need to be focusing upon? Where is the potential excitement in terms of whether it's vitamins or minerals or what we call bioactives, which is a broader term of other nutrients and or components of food that might be beneficial or not. So understanding where we need to be doing additional research. And again, as we mentioned earlier, the U.S. Preventive Services Task Force did come up with their recent updated guidelines. So thinking about how we look at those guidelines and interpret them and try and make better decisions about how to incorporate dietary supplements or not into how we approach prevention and integrative medicine with patients on an individual level, as well as from the broader public health perspective. So it'll be a little bit of an attempt of a tour de force across many different supplements, but at the same time trying to understand more carefully about how dietary supplements fit into the concept of integrative medicine.